Good afternoon, everyone. My name is Christy Durham, and I am the Quality Improvement Specialist for Network 8. I want to welcome you this afternoon to the Network 8 Transplant Quality Improvement Activity Kickoff webinar. During this webinar, we will discuss project goals and expectations that will go on during this project. In order to minimize background noise, I do have all of the lines muted, and they'll remain muted throughout the duration of the call. Please remember that if you have any questions, make sure you enter those into the chat box, and I'll go over all those at the very end. The Transplant QIA is one of Network 8's required projects for 2021. There are 4 project goals. The first goal is to promote early referral to transplant and to assist patients and providers to improve referral patterns. And this will be done by addressing barriers identified as the patient moves through the process leading to transplant. The second goal is to provide educational materials to patients and staff based on barriers identified. The third goal is to promote communication between dialysis facilities, transplant centers, hospitals, nephrologists, and other healthcare providers. And the fourth goal is to implement what's called the Transplant Champions. This is something new this year, so the next few slides will go over what that transplant change package entails. So this slide shows primary drivers and secondary drivers within the change package. This change package is intended to support dialysis facilities and ESRD networks in increasing the number of patients referred to transplant centers, evaluated for kidney transplantation, and placed on transplant wait list. The change package includes actionable change ideas, which have been collected from top performing dialysis facilities. These facilities excelled at having patients placed on transplant wait list. So as I mentioned, you can see that there are 5 primary drivers, and each primary driver has multiple secondary drivers. These secondary drivers provide ways in which the primary drivers can be achieved. So these are ideas that are intended to serve as a menu, so to speak, of interventions that you can choose from to implement within your facilities. Monthly, facilities will be conducting interventions related to these primary drivers from the change package. So we'll just briefly go over each primary driver and a couple of the secondary drivers. So primary driver 1 is to create a pro-transplant culture. You can begin this process by designating 1 or 2 champions to drive your transplant efforts, and you can also establish a facility mission statement that includes transplant as well. Primary driver 2 is to implement continuous quality improvement. You can track transplant referrals and engage all staff in the review of data to assist with that primary driver. Primary driver 3 focuses on continually following up on the transplant status of patients. Patients should be provided with the knowledge, tools, and support needed to help them move forward in the transplant process, and communication between transplant centers and dialysis clinics is also key to staying informed of any patient's transplant status. The fourth primary driver is to educate and support patients. Education should be provided early and regularly, and support should be provided to patients throughout the whole entire transplant. The final primary driver is to provide education to staff. This education will, of course, help staff maintain their knowledge of transplants and the transplant process. So as we talked about on the previous slide, designating 1 or 2 transplant champions to drive transplant efforts can help create a pro-transplant culture. When your facility received your email notification that you were in this project, you were asked to designate 2 transplant champions. So please ensure that these individuals are interested and passionate about promoting transplant, and that they're willing to speak with patients about the benefits of transplant. These champions will assess the patient's level of understanding and educate them based on their level of health literacy, making the information easy to understand. And a transplant champion can be any member of the team, a physician, social worker, nurse, dietitian, patient care technician, or even a unit secretary. So once you've chosen your transplant champions, one thing that I would like for them to do is to create a transplant binder. This is a way that you can organize your materials, and it will assist with monthly tracking of your referrals and progress. And it'll also help ensure that that implementation of continuous quality improvement is maintained. All your materials will be organized and in one location so that at any time, any staff member can quickly access that information if a patient requests to know where they are in the process. So to get you started on creating that binder, I do want to go over a few items that can be included, and these things include a prioritization matrix, a patient tracking tool, transplant center tip sheets, and patient educational materials. So we'll go over each of these in detail. The first thing is a priority matrix, and this is an optional tool that you can use. This will help determine which patients to focus on each month. It's a decision-making tool, and you can use it to prioritize a list of items into an order of importance to select and determine further actions. So you can enter transplant candidates into a list, and then the correct priority would populate them based on that entry. For example, if you have a patient, Mrs. Smith, and you know she's a top priority because she has her transplant scheduled this month, then you would enter her name, you would answer yes to top priority, yes to this month, and that would pre-populate it into that green box that you see on your screen. If you have another patient who is a top priority, they're extremely interested in transplant, they've started the process, but they need some testing scheduled, then you could enter that patient's name and enter that they are a top priority. They don't have it scheduled this month. That would be a no, so that would pre-populate into that orange box that you see. Again, this is optional. If you feel like that this is something that would benefit your facility, then you can get with me after the webinar and I can provide a template and then also give you more detailed instructions on how you can use it. Second thing that your binder should contain is a patient tracking tool. Using tools like this to track each patient's wait list or transplant status is very beneficial. You can do this by using a paper version like you see here on the slide, or you can also document in the electronic health record. You can use dialysis specific software with reminders or the Helping Hands web tool, or track in an Excel spreadsheet. If you don't currently have a way to track patient transplant statuses, then please let me know and I can provide a paper form for you to use. The next item are the Transplant Center tip sheets. Network 8 developed these tip sheets from each of our regional transplant centers, and they include eligibility criteria, exclusion criteria, referral and evaluation processes, in addition to other helpful center-specific information. I will be providing these tip sheets to you via email after the webinar, so please make sure that you print these and include them in your transplant binder for easy access. Throughout the course of the project, you will also be provided with numerous educational materials to share with patients. I'm sure you already have educational materials through your corporations as well. So just please try to print these and add these to the binder again, because it can serve as a resource for other staff in the facility to access as well. The next couple of slides will just go over some other helpful resources that we will be using throughout the project. The first is the Network 8 patient portal. Networks 8 and 14 collaborated to develop patient portals for each of the networks. And so these patients will be able to access these portals through a web link or by scanning a QR code with their smartphone camera. And the goal in developing these was so that we would have a platform to reach patients directly. If you haven't already viewed the portal, or if you have, then please view it again because we do try to update items on a regular basis. Please access it and take a look at the items that we have. There are numerous educational resources. We also have a page for upcoming events for patient webinars that may be of interest to some of your patients. So please view the portal and share it with your patients as well so that they can view the resources. The next item, the National Coordinating Center also created something similar to our patient portal. Theirs is called a kidney hub, and it also has numerous helpful resources related to COVID, transplant, home, infection prevention, and well-being. And this can be accessed by visiting www.thekidneyhub.org. I will be using resources from the Kidney Hub throughout the project. If you click on the transplant link within the Kidney Hub, it will take you to a transplant hub that contains a lot of helpful resources. I know that was a lot of information. I'm trying to keep it short and brief. The main focus of this, again, will be implementing things from the transplant change package. So we'll be becoming more and more familiar with that as we go along. For immediate next steps, I do ask that you notify all of your staff in the facility that you will be participating in the Network 8 Transplant QIA. That will again help establish that transplant culture within your facility. Please make sure that the transplant champions that you named that they create that transplant binder. Again, some items that they can include is that priority matrix, the patient tracking tool, the transplant tip sheets that I will email to you after the webinar, and then just any kind of educational materials that I provide you throughout the course of the project or any that you already have on hand from your corporation. A third thing that you may be interested in doing that will help along the way is to select a patient transplant navigator. If you have a very motivated patient in your facility that loves to talk with other patients or loves to provide education or just is a advocate, then you can name this patient as your transplant navigator, and that patient can serve as a source of information regarding the transplant process to other patients in the facility. And then finally, in January, implement interventions for this QIA will begin. So I will provide an email to you that will give those specific interventions. So please be on the lookout for that. These interventions are mandatory as we continue to track progress toward the CMS goal for transplant. Here's my contact information on this slide. Please do not hesitate to call me or send me an email if you have any questions or if you need clarification on anything. And at this time, I will open the chat box and see if we have any questions. I'm not seeing any questions right now. Please remember, if you have a question, to submit it in the chat box and we will go over it. I see that some are asking for a paper copy of the patient tracking tool, and I will be happy to provide that. Yes, I can absolutely send the slides to you. I am recording this webinar as well, so I will provide the recording link as soon as it is available. Any other questions? And again, you can always email me or give me a call after the webinar. I see some more requests coming in for the templates. I can provide that. Okay, well, I don't see any more questions coming in. I really want to thank y'all. I appreciate your time, and I wanted to keep this brief today and just provide a brief overview of what to expect. Again, interventions will start in January, so you will be getting more information from me on that. I thank y'all so much, and we'll conclude the webinar at this time. Bye-bye.